Welcome to this edition of the LucidQuest Digital Health and AI Strategic Roundup, covering developments from 3 July to 2 August 2026. The defining story of the period was healthcare AI's shift from standalone tools toward integrated platforms built around proprietary data, clinical connectivity, and continuous evidence generation. Competition is moving beyond algorithm performance. Increasingly, advantage may depend on who controls the data, infrastructure, workflows, and distribution needed to deploy AI at scale. 4 themes stood out. The first was the growing strategic value of proprietary biological data in AI-enabled drug discovery. GSK's expanded collaboration with Relation and Bristol-Myers Squibb's investment in NVIDIA infrastructure both point toward long-term capability building, rather than reliance on external software alone. The strategic objective is to combine computing capacity with differentiated experimental data that can support multiple research programs. For executives, this suggests that discovery competition may increasingly be shaped by access to biological datasets that are difficult and expensive to reproduce. Companies able to generate these assets internally could improve target confidence and reduce dependence on external platforms. However, it remains uncertain whether richer datasets and greater computing power will translate into better clinical candidates, lower attrition, or shorter development timelines. A second theme was the convergence of digital health platforms around longitudinal metabolic and chronic care. January AI, Samsung, and Dexcom are connecting clinical records, wearables, nutrition, glucose data, and AI-guided support to create a more continuous view of the patient. The competitive unit is no longer simply the sensor, application, or coaching tool, but the wider environment linking everyday behavior with clinical decision-making. This could strengthen engagement, create more persistent patient relationships, and open commercial routes through providers, employers, payers, and enterprise partnerships. The unresolved question is whether continuous monitoring and personalization will produce measurable clinical improvements and lower costs, rather than engagement alone. The third theme involved the emergence of real-world evidence as a bridge between regulation and reimbursement. Dexcom's selection for the FDA's Tempo pilot, alongside the CMS Access model, provides an early test of an outcomes-linked pathway for AI-enabled chronic care. The model could allow technologies to enter routine care, while manufacturers generate evidence and work toward appropriate authorization. Strategically, this may offer a more suitable framework for software that evolves rapidly and depends on real-world use. Yet the level of regulatory flexibility, the evidence thresholds, and the durability of reimbursement remain uncertain. The fourth theme was investor preference for reusable AI platforms. Financing for Chai Discovery and TitleSense reflects interest in technologies that can expand across targets, diseases, or markets. Platform breadth may support multiple products and partnerships, but it can also obscure product-level execution risk. The key question is whether scalability will create durable commercial value or simply add complexity. Looking ahead, we will be watching for evidence that proprietary datasets improve research productivity, early outcomes from Tempo and Access, deeper integration of metabolic platforms into clinical and payer workflows, and stronger validation that AI-guided care improves outcomes. The key takeaway is that healthcare AI is becoming a systems competition. Leadership may depend less on owning the strongest individual model and more on combining differentiated data, scalable infrastructure, clinical distribution, and credible evidence within one platform. Thank you for joining this edition of the LucidQuest Strategic Roundup. For more healthcare market intelligence and strategic analysis,